Um, so ABCD after breast cancer diagnosis. So today I'm just going to cover briefly the role of male breast cancer mentors. And so thankful to be able to follow I don't know how to follow Dr. Cardosa, but the information she shared is just so timely and information that we want, all healthcare providers, anyone in this space to have access to so that they can provide, proper treatment and that males can understand, their diagnosis and how to advocate for themselves. Just a little about me. I am the Director of Healthcare and Community Partnerships, and I was diagnosed early stage with breast cancer in 2018 at the age of 46. Went through standard care and standard treatment, was able to do a lumpectomy with reconstruction, only needed radiation. Had been in remission for about 4.5 years and unfortunately had a reoccurrence and am now stage 4 with metastatic breast cancer as it did spread to my bones and a little on my liver. So Dr. Cardosa, all of the information you shared is timely to see the differences in treatments for the similarities and the differences. So thank you for your information as well. So today, and thankfully I'm stable due to clinical research and medicine. So I am so grateful for that. So today I just want to give a quick overview of how ABCD after breast cancer diagnosis, our vision and mission and how we aim to help anyone anywhere at any stage. And that includes anyone diagnosed with male breast cancer, regardless of gender. Talk a little bit about male breast cancer mentors and why they matter. Talk about our match process, the role of mentors, whether it's through our organization or informally, how that role is so critical, and the power of one-to-one in these lived experiences that they can share with one another, and the benefits of being a mentor that they receive from mentoring someone else along this journey. We do know at ABCD after breast cancer diagnosis that being a mentor gives you the opportunity and gives others that got the hope and the guidance and being able to offer them compassion that's so needed to do that for someone that's going through. And we're grateful. I believe it was in 2023 that we started having conversations with the Male Breast Cancer Global Alliance to see how can we form a collaboration, a partnership to make sure that we can reach those who do need this emotional support. So we were proud to partner with Sherry and the Male Breast Cancer Global Alliance to start offering our support in the form of trainings to male breast cancer survivors so that they could have some skills to offer support to other patients going through the diagnosis, but then being there to also give them support as they need it. For ABCD, our vision is, again, anyone impacted with a breast cancer diagnosis, we want them to be able to receive access and support. And this includes the patient as well as their family member or caregiver. So we want to just be able to touch and have support for anyone impacted by a breast cancer diagnosis. And again, that hope is we want to be able to transform their lives with the emotional support that we're offering. We offer free, personalized one-to-one support, again, to anyone diagnosed with breast cancer. It's a fully virtual training program. We're fully virtual, so that allows us to help anyone, no matter where they are located. And I'll get into some of our mentors and how our training program was developed. Our history, just to share a little bit about how we were founded. Melody Wilson Oldenburg was diagnosed with breast cancer. It later evolved into metastatic breast cancer. But during her early diagnosis, she just really wanted to impact and connect people to get them that one-to-one support. And her vision was really that if anyone was diagnosed with breast cancer, she wanted to connect them with someone that shared the same type of medical diagnosis, whether they were early stage, late stage, whether they were female, male, whether they were triple negative, what types of, chemo treatments, what types of treatments are they taking, in addition to who they are as a person. So, are they vegan? Are they a mom? Are they a dad? Is faith important to them? So just being able to connect them on similarities so that they can talk about how the breast cancer is actually impacting them and their lifestyle. To touch on the importance of why male breast cancer mentors matter, we know that there are lots of, emotional, distress. There's stigmas associated with the diagnosis, and so we know from our history of just training, starting out, training women, that being able to talk to someone one to one that has that same lived and shared experience is just really beneficial to the patient or participant that's going through a breast cancer diagnosis. And it does help bridge the gap, especially for male breast cancer patients, to be able to talk to another male that has experienced what they're going through or are about to experience, to be able to offer and provide that connection. And that can help bridge the gap with the isolation that they might feel. I know throughout the conference, we've been hearing these same terms from a lot of the presenters around the emotional effects of breast cancer, especially for males, that feeling of isolation, the stigma that this is a disease that only affects women. And so there could be denial, there could be shame around the diagnosis. There's exclusion, there's limited resources because, the healthcare professionals may not know, exactly what treatments to offer or just really how to address the emotional aspect for male breast cancer patients. So, with this being at the forefront, it's important for us at ABCD to make sure that we do have male breast cancer mentors and that we can train mentors who could offer that one-to-one emotional support. Our services, we want to make sure that with our training that we are a complement to the medical care team. So being able to make sure that nurse navigators and social workers that they can refer patients to us and that then we can match them with one of our volunteer mentors who has that similar diagnosis and can provide that support. Our signature matching, again, is that we want to match anyone who contacts us for support with someone who shares that medical diagnosis, but then also a similar age and stage in life so that they can talk about how the breast cancer diagnosis is really impacting them. With our match process, we always want to make sure people know that our services are free. There is no wait list. It is easy to have a mentor if someone wants a mentor if someone is referred to us. Basically, if it's a healthcare provider or definitely working with the Male Breast Cancer Global Alliance, with our referral process with the Male Breast Cancer Global Alliance, if someone is referred to us, that can be done over the phone, through email. And once they're connected to us, our goal is within 24 to 48 hours, we do want to get them on the phone and start that conversation to find out what's important to them, find out more about their medical diagnosis, who they are as a person, so that then we can look into our system of male breast cancer mentors and see who could be the best fit to kind of start that process. Just to share a little bit about the training topics that we go over, it's important that we want to make sure our mentors have, listening and communication skills, that they're able to talk about their survivorship, that they're able to offer that empathy, having active listening skills, showing some, encouragement, of course, being respectful and keeping the participants' information confidential. Things that we do train our male breast cancer mentors. So far, we've had, I believe, 2 official trainings for male breast cancer mentors. However, we have had throughout the years different one-on-one trainings with those who have expressed interest in becoming mentors for us. We know that mentors, we train them not to offer medical advice, but to more so provide for me statements that could share their lived experience. Our mentors are not professional counselors, they're not licensed therapists, they're not on duty 24 hours, 7 days a week. So it's important that when people reach out to us for support, we let them know what our mentors, the services and the emotional support that they can offer and what they can't. And it's great for us as an organization to be aware of what our other partner organizations can offer, so that if a mentor has a participant that has needs beyond what we can do, maybe they need counseling or a mental therapist, maybe they need financial support, we're able to also train our mentors and also leverage the expertise that they have from their own lived experience in terms of resources to then refer that out to anyone that's contacting us for support beyond the one-to-one emotional support that we offer. We do know that there is power in these one-to-one connections. As an organization, for 26 years, we've been doing mentoring, training mentors. We know that there is so much value when you can talk to someone that has this lived experience that can help offer the encouragement, that's able to listen and offer that empathy, that can help you see yourself as normal and help normalize the diagnosis that is not so unheard of, and kind of get rid of some of the shame or fear of the diagnosis, especially for male breast cancer patients. And they can also talk about the resources maybe that were helpful to their family members, to children, to a spouse, to a partner, and how they were able to, walk, through this journey and be able to just feel, the diagnosis is heavy, but to feel okay about going through it. Also, we know that there are benefits of being a mentor. Myself, I started out after my first breast cancer diagnosis, I became a mentor with ABCD. And being able to talk to, others who have gone through it, it was also, I knew that I was helping, but it's also beneficial to you as a person. So we do know that once these connections are made, that the mentor themselves can walk away knowing that they've made this impact to empower someone else through their diagnosis. And you do receive this personal fulfillment of knowing that you are helping someone else, being able to cope, and you're giving back to them. And then just lasting connections. Many of our mentors they start out talking over the phone, or through texting. If they are, close enough in proximity, they will meet in person if that's optional, if they would like to do that. But it just definitely being able to talk to someone around this shared diagnosis and lived experience is helpful and does give that personal fulfillment. We know that with research, I know we've been talking about it as we talk about what's needed during and throughout survivorship. We know that research does show that if someone can have this peer-to-peer support, they could have improved survival rates. They could have, less stress because now they, have someone to talk to that understands, that really gets what they're going through. And it can help them to finish their treatment because now they can talk to someone, ask questions. Again, where mentors are not going to give medical advice, but they could help them formulate, what questions should I take back to my, medical care team, and help them to support them in that fashion. And they could also help with them being able to, again, explain it to their family, to their friends, to their children, and that could help improve with their social and family relationships and dynamics. Again, we do train our mentors virtually. We ask that if someone does want to become a mentor, a male breast cancer mentor, that they are a year out of their major diagnosis. A year away from chemo or radiation treatments, if they're doing any hormone therapy. they could certainly become a mentor for us. And if they're metastatic, they could become a mentor for us at any time, as long as they feel emotionally, mentally, and physically capable of providing their giving of themselves to someone else. At the top of mind for us is that we always want self-care to be important for oneself. You can't pour into someone else's cup until your cup is also filled. So we always want to make sure that our mentors are receiving the support that they need. If they also need a mentor, if they may be having some anxiety around their own diagnosis or treatment and they need a mentor, we can make sure that they're able to connect and talk to someone else. If they ever need to take a break, especially maybe they're caring, for a loved one, or dealing with, their own diagnosis, if they need to take a break or they're traveling, they can always do that as well. Currently, we have it continues to grow over around 300 mentors, so 295 and growing. I know we have about 3 more mentor trainings coming up. We just did one for male breast cancer mentors. I believe that was in September. So the number of mentors that we have, of course, the number of male breast cancer mentors is growing. This 295 plus represents diversity of mentors. So women and men diagnosed with different, whether it's early stage, late stage, triple negative, metastatic. It could also include some of our previvors who are mentors that are genetically predisposed to breast cancer, in addition to caregivers. So we want to have mentors located across the country that can impact anyone that's diagnosed with breast cancer, no matter where they live. For 26 years, again, our reach continues to grow with the number of one-to-one matches that we make, the number of people that we serve, and the number of mentors that we train just continues to grow. This is just our staff. I just wanted to, highlight our executive director, Ellen, as well as our director of service, Carrie. These are the main people who were responsible for helping us to make the connection with the Male Breast Cancer Global Alliance, so that we could ensure that we're able to train males that are interested in becoming a mentor and offer that one-to-one support. We know that if male breast cancer patients can get that support, it can help them to, feel supported, feel less invisible about the diagnosis. The mentorship can help bridge the gap. Males, breast cancer mentors can help offer that guidance, that support, um, and the moral support, sharing that lived experiences, and also those coping strategies. Um, we know at the end of the day that being able to talk to someone that shares that diagnosis, that someone can share whatever their experience was. We know that having trainings that are individualized for male breast cancer patients, when we do our virtual trainings, we do trainings separately for male breast cancer mentors, because we want to give them that open space to be able to dialogue and connect. And they're going to maybe connect differently than females or women would connect when they go through training. So we want to allow them the space to have a training where it's just them. And we do have different webinars, what we would consider, self-care opportunities or continuing education, where mentors can log in to different webinar series that we have and learn about self-care, learn about how this support to others is helpful for themselves. They can also learn about new treatment therapies, whether it's lymphedema, just learn about how to live through this diagnosis. And we know that at the end of the day, just being able to make these connections and being intentional about the connections, not just connecting them with the next person or someone that had breast cancer, but really being intentional to learn about the type of breast cancer that they have. Is it hormone positive or negative? What types of, treatment options are they looking at? And being able to actually talk to another male that's gone through it. We know that it's just really beneficial for just the overall emotional, mindset of the patient. So again, this is just why it's so important that we're able to have programs like this and to be able to offer. So for those that need support or they need to interested in becoming a mentor, it's just so important that we're able to continue to offer these services so that people, especially males, can get the support that they need. So thank you for the opportunity to share a little bit about what we do and how we can continue to connect and bridge the gap for male breast cancer patients.
Oh, thanks, Keisha. We really appreciate the partnership. And it actually was just as easy as a conversation with you and Ellen at one of the, I think it was ASCO or one of the meetings that we were
Yeah.
at. And we both felt that there was such a need for this. I do have a couple questions for you
Yes.
that I've seen come in. One of them says, as more male survivors come forward, what is your long-term vision for mentorship in the male breast cancer community, locally, nationally, and globally?
Um, that's a great question. I know that we want to, as part of our goals and strategic planning going forward, we want to make sure that we have more men who can be male breast cancer mentors and located, across the nation. We want to be able to offer that support. We're also starting something called a mentor council, and within the mentor council, we want to make sure that we have like kind of lead mentors that can answer questions and be kind of a contact. We have what we call a private Facebook mentor page where the mentors themselves can log in and they can connect with one another, ask questions. So I think the more opportunities that we can provide where they can have space to connect and have conversations about their lived experiences, then in them sharing, those experiences, that's going to continue for them to be, I know you said ambassadors, for them to be sharing what they do and how this is beneficial, and then that can encourage other men to speak up, not be silent about the diagnosis, and share why it's important to hear their voice, whether it can then help with representation in clinical trials, improve treatment therapy. So it's just really important. The more that people can know that we have mentors and that men are willing, they are willing to share their stories. It's just that the training might look different than what it is for females, but I think that will increase our reach the more people that know about it.
Absolutely. And I know you said nationally. I know that Rod is actually in Australia, so
Yes.
he's one of our
Yes.
Australian men. Um, Do you have any intention to do any type of other languages, say, for the Spanish community? And
Yes. Yes, we do. That is one of our strategic goals as well, is to make sure that we have more mentors that speak multiple languages. So definitely, Spanish speaking mentors in some of our, areas. It might be a heavy concentration of, Asian or Hmong. So we really are trying to, and in my role with outreach, reach out to various organizations and communities to make sure that if they have breast cancer patients, male, female, we just want to make sure that we can incorporate the different languages so that we can get them connected, so that anyone looking for support, that won't be a barrier to getting that support.
that's great. Let me see what else came through. How do male mentors help with challenges beyond the hospital, such as body image, relationship, work, and identifying and regaining confidence after treatment?
I think with being able to share the lived experience, and that's the power of that one-to-one. So, for men to be able to maybe talk about, sexual health, to be able to talk about like, physical appearances, how things look different. I think for them to be able to, maybe it doesn't have to be in like a group support setting. They may not be comfortable, but being able to talk to someone one-to-one and to start out the way that we do with being able to talk over the phone or to start out with a text, that's a lighter way to start the conversation. But I think knowing that the person on the other line is someone that has been through this diagnosis, it's not the clinician can give us all, the great information and the medical expertise that we need, but being able to then talk to the person on the other line that's actually experienced it, that's not afraid. And that's the great thing about our mentors are, male breast cancer patients that are ready and willing to share their story, to be honest, to give the nitty gritty, to kind of harness the power of their journey. So being able to then talk to someone that's not afraid to really share, this is what happened to me, and this is the resources that I used. I think that's beneficial to a patient that's looking for that support.
Okay, very good. Is there any limitation or end to when a mentorship with an individual stops? And I guess, in other words, is there a limit to the amount of time that you can have a mentor or something
hmm
along those
That's a
lines?
great question. Our mentor program allows for the participant to decide how long or short they need to talk to that mentor. So once the two are connected, it's really up to the participant how long or short that relationship will last. So if they have a couple of questions, perhaps about a new drug treatment, maybe their medication is changing, that could be maybe 2 or 3 phone calls, and maybe they, don't need any additional support. Obviously, with someone that's newly diagnosed, that's trying to determine what surgery are they going to have, what the side effects will be, if they're looking at radiation or chemo, what types of targeted therapies, that relationship will be longer. And so they may talk on the phone, before a treatment or, and after, before a surgery and after. So it's really up to the participant, how long or short that relationship is. We do ask that once our mentor has accepted a match, that they do, reach out to the mentor, and that they do talk to them at least 2 times. And then it's really up to that participant, how long they want the relationship to last. And it's okay for our mentor to ask, you mentioned you have an upcoming appointment. Is it okay for me to check in with you again in 2 weeks? So many mentors will, send a check-in and continue that relationship that way. And some have actually met in person after they've made a good connection. We do also want feedback from our mentors and the participants. So we do send out a survey within 2 weeks of that match, so that they can report back to us, any pros or cons. How did the match go? Did you get the information that you were looking for? And if they need to talk to someone else, we're able to match them with another mentor as well.
Okay, so you're not, I know that topic came up yesterday when we were talking to Dr. Bartlett. You
Mhm.
have to mesh with somebody, and not
Mhm.
everybody is comfortable
Right.
with the same people. So it's got to be a comfortable fit too.
Yep. And we definitely,
Yeah.
we allow that space and grace. We believe that, with our match team, that, the connections is not AI driven. They actually have interviewed every single one, anyone that wants to volunteer for us to become a mentor, they've interviewed them. So during that interview process, they found out their medical diagnosis and who they are as a person, and what really drives them. So we kind of know who our mentors are. And then when a patient is referred to us, we do the same thing during that intake call. What's important to you in this mentor relationship? Who are you as a person, the medical diagnosis, your family lifestyle? And then now we're able to make that match. But if it didn't match, either one of them can always give us a call back, and we're going to try again until we get that right. That doesn't happen too often. Most of the time, we do get them matched, but that is, if it's something is off, they can always let us know, and we'll do it again.
That's good to know. When a man hears the words, "You have breast cancer," many men feel shocked, isolated, or even ashamed. Why is mentorship so powerful in those first months of fear and confusion?
Um, I think, and sort of speaking to from my own personal experience, it's just that power of that shared and the lived experience. So, for males, just being able to talk to someone that's been through it. When you're first diagnosed, we all know, like you said, there's confusion, there's fear, not understanding, why this is happening. I know a lot of, people once we're diagnosed with breast cancer, you go straight to, why me? What did I do something to cause the
Mhm.
diagnosis? So being able to talk to someone in those, which I would say is a crucial time frame, those initial weeks, days after being diagnosed, being able to talk to someone that you can hear from them, even if they're not saying, like that they've been through it, like just to be able to know or even to hear like, oh, I'm 3 years out from this. I'm, 5 years out from that. That just gives hope. It fuels hope in someone being able to talk to a mentor. So I would say it's really crucial, during that initial time frame to be able to get connected and just to help alleviate some of the fears or to be able to help, with some questions now that you can take back to your medical care team to get that medical expertise and information. And the great thing about this mentor relationship is that, they can come to us 2 weeks after the diagnosis or, 2 months, 2 years. It's really at any point that they feel like they want to be connected to somebody. We want to be able to have a male breast cancer mentor that can talk to them and walk them through their questions.
Mhm. I have one, looks like one more for you.
Mhm.
Male breast cancer affects families too. In what ways can mentors support spouses, children, or caregivers who may also feel scared and invisible in this process?
That's a great question. We do, and that's another reason why we want to train, caregivers. So whether it's the spouse or partner of
Hmm.
a male breast cancer patient, we want to be able to have, it could be you know, let's say a child, adult child of the breast cancer patient. We want to be able to offer them training so that they can learn how to communicate, how to show empathy, how to understand what emotional stress is being caused by the diagnosis. So with us being able to train caregivers, partners, spouses, adult children, that offers another line of support for people calling in. And it's important for us to know what's on the landscape, what's out there that our partner organizations are doing, since we don't offer, you know, um, you know, transportation or financial assistance or clinical licensed therapists. We want to be able to make sure that we can connect and offer other organizations that have those key resources that we can offer that to those mentors that need that additional line of support. Because we know, being diagnosed with breast cancer, it doesn't just affect the male breast cancer patient or the female, it affects the whole, family unit and structure. So we want to be able to, anyone impacted with a breast cancer diagnosis, whether it's you personally, that family member, we want to be able to have support for them.
Yeah, and that's so crucial. And for anyone listening, this is exactly what we do as advocacy organizations.
Mhm.
We work together, we lean on one another. I don't think there's one organization out there that can say that they do everything.
Right.
We all rely on our fellow organizations to fill in the gaps, if you will, in
Yes.
areas that we do not have the expertise on. And
Mhm.
it's wonderful to partner with you
Mhm.
guys. And we love
Yes.
what you're doing. So thank you.
Yes. Thank you. You as well. And I think it was mentioned earlier, just the power of advocacy when we can all come together as organizations, as healthcare professionals to, advocate for those impacted by breast cancer and to bring about change. So we have to
Yep.
share our stories and use our voices to bring that about. So thank you for the opportunity to work with you and hopefully to impact more male breast cancer patients that need support.
We'll keep doing it. I'll see you in December and we will do just that.
We will do just that. Thank you.
Thanks, Keisha.